So we have a full schedule today, everybody. Welcome again. This is day 2 of our residency roadshow presentation for residency programs. Most of the programs that are going to be presenting this week are Bastille-affiliated residency programs. And today, majority, if not all of these presenters are presenting residencies that have a naturopathic oncology focus. And first in our list of speakers today is Dr. Chad Atchison. He's the medical director of Seattle Integrative Oncology. Welcome, Chad.
Thank you, Dr. Garcia. I also have Dr. Erica Joseph here, somewhere here. Yeah, there she is.
Hi, Erica.
To help fill in the gaps. And I'm going to try to go quickly through this. Gary, are we allowing questions from students or potential candidates during this time, or are we just giving our
We'll just give about an 8-minute presentation, then we'll have about 2 minutes for questions.
Okay, sounds great. Well, I'll try my best to give you a good idea about our residency and go over some of the highlights. We just have kind of a modified job description up here on the screen to walk through and give you just a little more information about our residency. You can see that we are 5 naturopathic physicians and 2 acupuncturists here in our facility. On our highlights there, you can see a little bit of information as far as introductory. We're a CNME residency affiliated with Bastille. We're also ABNO approved. And at the end of our 2-year residency, that makes a resident physician eligible for the FABNO exam. We also have a acupuncture education component, if that's applicable to the particular candidate, and primarily focusing on oncology acupuncture, both in practice as well as in some additional training. We're in 4 different locations. Our primary practice is here in Seattle on the east side of Lake Union, essentially between the University of Washington and downtown, or Seattle Cancer Care Alliance. We have 2 outlying facilities that we go to between all of our physicians, usually twice a week, sometimes 3 times a week. And those are affiliated with Providence hospitals, one in Olympia and one of them in Everett. And of course, since COVID, we've been doing quite a lot of telemedicine. Let's see here. Oh, there we go. A little bit of history. We're the first naturopathic oncology residency training opportunity here in the Pacific Northwest. We've been operating since 2014, that residency program. And have been in private practice since 2008. The curriculum and essentially the format of our residency is born out of the CTCA, or Cancer Treatment Centers of America model, which no longer operates residencies, unfortunately. But we're pretty heavy on that type of a format, which includes a fair amount of didactic work, usually a full day per week. A lot of that is self-study, although there is an interactive sort of lecture or sort of Socratic method conversation basis to it. A lot of observation and participation in direct patient care, clinical rotations, and frequent CME opportunities. That makes up about 1 day a week. And then a handful of other opportunities that you can see there, those 3rd bullets, or the last 3 bullets. Application process, I won't bore you with that. You're all probably familiar with it at this point. I will just mention that this is a standard application for the 1st-year residency, and our goal is for, upon successful completion of that 1st year, you roll right into the 2nd year as long as everything is going well. And then a little bit about position objectives and some duties and responsibilities. Not much to call out here. We do have limited on-call, so not much for an on-call program. We do, gosh, I got a little distracted there with somebody having espresso.
Sorry about that, Ken.
But we do a lot of specialty rotations. We have residents spend some time with other naturopathic oncology professionals, but certainly with surgeons, maybe emergency room doctors in the local area, pathology, radiation oncology, radiology, medical oncology. We try to get through a number of rotations, primarily through our 1st year, but also into the 2nd year. A lot of tumor board attendance as well. Dr. Joseph, anything else to add in here with duties and responsibilities?
I don't think there's anything that you missed. I might just add that I think we have a wonderful reputation as being one of the busier residencies. So we have a very busy patient practice because there are four of us that are FABNOs. Our residents have the opportunity to spend time with each of us. They spend the majority of their time with myself and Dr. Eshchin, but we certainly have a lot of coverage. So there's rarely a quiet day or too much downtime unless you're attending a conference or doing some self-study. So we definitely try to keep our residents very busy and active and seeing just a lot of patient care.
Great. There's an ongoing evaluation process, as you would expect, not only by us, but also with our university affiliate. Most of the time, there are quarterly evaluations with Dr. Garcia, but we intend to have informal evaluation that's ongoing throughout the year to help the resident to improve continuously throughout the year. Looks like I lost. Oh, there we go. And a little bit about compensation and benefits. Ours is a salaried position, competitive compensation. Benefits include your liability insurance, your membership dues, an annual CME allowance, and then an allowance for your health insurance. And what makes a good candidate? We certainly are a program that is a bit heavier, I would say, in basic sciences, understanding the pharmacology, the pharmacognosy as well. We do interact quite a lot with medical providers. And that's that point number two of being integrative minded. It's really important for a candidate to want to be working along the whole spectrum of care that your patient might experience, from a primary care MD all the way through, medical and radiation oncology, as well as surgeons. We have to be able to interact with them on a daily basis. And we're looking for candidates who are curious, eager to learn, certainly people that are willing to work hard and self-directed, and ultimately able to be a really good team member. Dr. Joseph, anything else to add to that?
No, I think you encompassed it well.
I think we might have made it just within our 8 minutes.
Yeah. If there are any questions for us.
So students can either type into the chat or unmute themselves for any questions.
And if it's easier, if there's some follow-up questions that you'd like to send to us via email, because they're a little bit longer, I'll just go ahead and put my email into the chat box. Yeah, feel free to email us directly, and we're happy to chat with you a little bit more and answer any questions you have about the residency. Okay.
Okay, if there are no more questions, thank you. Thank you again so
Yeah.
much, Dr. Ashton and Dr. Joseph, for your presentation. Our next presenter today is Dr. Liana Standish. She is the medical professor of here at Bastyr University, and she's also the residency director at AIMS, Advanced Integrated Medicine of Seattle. So welcome, Liana. Floor is now yours. I'll make you first the host.
How's the audio?
You can,
Audio
you can
okay?
simply share them with the group.
Okay. Hi, everybody. My name is Liana Standish. I'm a naturopathic physician. I also have a PhD in neuroscience. Our clinic, AIMS Institute, was started in 2018. We specialize in integrative oncology, integrative psychiatry, and integrative pain management. One of the things that I think is special about our clinic is that we do clinical research. We have 2 IRB studies tracking longitudinal outcomes in our cancer patients, and also an outcome study of changes in depression, anxiety, and spiritual health scores over time. We offer ketamine-assisted psychotherapy as a treatment modality for people with PTSD and depression. Last year, we presented a paper at OncAMP showing that ketamine-assisted psychotherapy was useful for cancer patients struggling with what we call cancer demoralization. We have a residency program. Right now, we have 5 residents. We anticipate hiring 1 or 2 in the next cycle. Our residents, the experience of our residency is one, intensive clinical care with complex patients. When we say integrative, what we mean by that is many things, including every Tuesday for an hour, the entire clinic does case review and kind of our grand rounds. The residents are expected to do research and to publish and to present papers and abstracts at the Oncology Association meeting of naturopathic physicians on a yearly basis. We see both solid tumor patients and hematologic cancer patients. My special interest is in glioma, blastoma, brain cancer, similar to Dr. Parmar, and what else? And Dr. Sunil Agarwal, who is the co-director of our residency program and co-director of the clinic, is an MD, PhD, with board certification in palliative medicine and pain and rehab. And so our clinic, we are able to care for Medicare patients through our incident to services through Medicare. So Dr. Sunil Agarwal will refer patients to the MDs here, and then we bill Medicare for those services. Very strong in IV therapy as well, pioneering, maybe not pioneering, no, that's too strong a word, just utilizing some of the best IV botanical medicine therapies. We're using IV curcumin, especially in sarcoma. And in brain cancer patients, we've developed a triple therapy for ovarian and breast cancer patients. We're using circulating tumor DNA as a short-term biomarker. And we just have a really way cool clinic. We have 18 people here, and including all the staff and all the physicians. And I'll stop and answer questions.
Okay, are there any questions from our folks online? There's a question here. Yes? The question, Dr. Standish, is how long is your residency at Ames? You're muted, yeah?
It's a 2-year residency.
I believe that's true for all naturopathic oncology residencies. The minimum requirement is 2 years, so they can sit in the boards.
The preceptees, we have a pretty good preceptor program here at Ames Institute as well, and we love preceptees to come, but we like 3rd and 4th and 5th year students preferably, and those that are willing to make a year commitment to doing at least 1 4-hour shift a week for an entire year here at Ames, which is relatively close to best year.
I have a question to follow that up. I'm from St. Bastier, San Diego. I'm a 4th year student here. And so for a 1-year preceptorship, which I totally understand, it would be impossible for me to do that. Would you accept short-term preceptors at your clinic for?
Well, we do occasionally. I'm not wild about it because our preceptees actually help us deliver care. It's less of a, shadow. It's more like get your work with us and get vitals and do chart notes and so forth. So it's not my fave, but everybody's individual, and maybe we could make that work out for you.
Okay, thank you so much for your time and for your answer.
Any additional questions from the group? We're still waiting on our 3rd presenter for today. Were there any questions for the previous speaker, for Dr. Achjan and Dr. Joseph? Chad, quick question. Do you accept students for precepting at your clinic?
We do. Similar to Dr. Standish, we prefer students that are further along in their education, 4th or 5th year students. Additionally, we typically do kind of the opposite in that we offer a couple of days at a time rather than looking for a long-term preceptorship opportunity with our residency program and just the format, particularly because we go to such different locations. It's probably more conducive for those students or residency candidates to come in for a couple of days, get a sense of what we do just on a short-term basis. So we certainly have people come in for, anywhere from 1 day to a week.
There's a question that came in. What are your thoughts about residents or at least students applying to residency that are both duly licensed in naturopathic medicine and acupuncture? Is a question for the group of directors.
I'll address that. I am an acupuncturist as well, and we do provide acupuncture here, and we would love to have dually trained people preceptor here. And we also have a 5-element acupuncturist here in our pain specialty division, who's excellent.
Yeah, likewise, duly licensed with Dr. Joseph. We currently have a resident who's also duly licensed, and it works very well for our practice and serving our patients.
I see, Gurdev, you're online. Do you have any thoughts about ND, LAC potential residents or preceptorships in your clinic?
So like my colleagues, a dual certified ND would be great. We do have a DTCM on staff here at our clinic, and I'm licensed to do acupuncture myself, although I don't ever really have time to use acupuncture in my practice. Yeah.
Vienna, your hand is up.
Yeah, I just wanted to mention another thing at Ames Institute. We're very touch oriented. We touch our patients a lot. And so I'm always looking for residents that have at least one hands-on modality: acupuncture, craniosacral, chiropractic manipulation, spinal manipulation. We do a lot of injection therapy here too. Oh, yeah, we have Dr. Forrest Dobbs on, one of our doctors here, doing stellate ganglion blocks for PTSD, doing joint regeneration work with plasma-rich platelets, etc. So we're looking for people that really like, procedures and touching people.
Okay, let's see. Is Dr. Michelle Nisley on the call now?
Yes, I'm here.
Oh, there you are. Okay. Well, good afternoon, Dr. Michelle. Let's see. She is the residency director at Pacific Integrated Oncology, and she's here to talk about her residency. So, Michelle, I'll make you first the co-host just in case you need to show any slides.
I don't. I am between patients and I'm here to chat.
Okay, all righty.
So great to see everybody. Good to see my colleagues, my esteemed colleagues attending today as well. So my name is Dr. Michelle Nisley. I'm a Bastyr graduate 01, so I've been doing this for a while. I ended up attending the CTCA residency and actually observed or supervised residents at CTCA and at Northwestern Memorial in Chicago for a while I was there too. So I own Pacific Integrative Oncology. We are a small clinic in Eugene, Oregon. We welcome preceptors. I caught the tail end of that conversation as well. So yes, we do accept preceptors. Because of our location, we usually do not have someone coming on for a year at a time, just because we're 2 hours away from national, obviously. But we welcome preceptors. It's a great way for you to get to know us and see boots on the ground, and a great way for us to get to know you. So it's myself right now and Dr. Stacy Dunn. Stacy Dunn is a ND as well as an acupuncturist. And we just had our first resident come through this program. She graduated. Her name's Stephanie Wang, and she was a Bastyr grad a couple years ago. So she just finished and is staying on with us as well. So we are much smaller. You know, Leanna's got 18 people at her clinic. With the 3 docs that we have here, we have 3 staff members. We have 6 people. We actually contract with a nurse who can access ports and picks. So we don't end up administering the IV vitamins ourselves. We actually have a nurse who does it, but we do a lot of IV therapy. We have a great referral network with the local oncology system here, Willamette Valley Cancer Institute, and other oncology groups in the area. So Eugene is located somewhat centrally in Oregon, and we end up pulling from Medford. We end up pulling from the coast. You know, Portland is 2 hours north of us. And so Portland area patients usually stay in Portland, but anywhere from Salem down to the southern border of Oregon to the coast, we have about a 3 to 4 hour radius in which we pull patients from. So we do a lot of integrative management, obviously, along with the oncologists. Our residents get to do rotations with our local oncologists, which is really nice. So they spend time with the medical oncologist, they spend time with the surgical oncologist. We actually have a second location. It's located in with 2 surgeons. So we are with Dr. Christine Cole-Morgan and Dr. Winnie Henderson. They own Oregon Surgical Wellness, and we have a space there as well. So it's really nice to be in an office where the surgeons are there. We can have whatever conversations we would like with them. Stephanie Wang was able to observe some surgeries that included plastics also, and so got to see some of those procedures. And so we are oncology focused, but we end up doing about 20%, I'd say, internal medicine also, because myself and Dr. Dunn have been around for a long time and have done a lot of different things. And if you think about the fact that oncology patients also have diabetes, they have migraine headaches, they have sleep issues, they have other internal medicine diagnoses as well. So we end up sometimes getting cases no one else can solve, probably just like, you know, some of my other colleagues do as well. I feel like those of us who have been around for a while tend to attract some of those people. So 2-year residency here as well. I believe it is correct that most oncology, if not all, oncology-based residencies are 2 years. So the first year, you spend the first 6 months studying and shadowing. You start to see some of your own easier patients, if there is such a thing. I think everybody is complex, but we start, 3 months of studying. All of the sites go by very specific, residency requirements, and it's actually broken out into what you're supposed to do based on the month. So there's a playbook for it, for lack of a better term. So the first 3 months, especially, you're studying, you're shadowing patients with us. Maybe depending on how you're doing, we're starting to get you in with some of those more simple, straight, early stage breast cancer, lumpectomy, relatively few comorbidities, starting to get you in with some of the easier cases. And then obviously progress depending on your comfort level, how we feel you're doing. We're going to observe you as well to make sure that you're feeling confident in the information that you're delivering. The second year, our second year residents are not on their own entirely, but they have their own caseload. They're working full time. Here we're closed on Fridays. We actually have only 4 clinic days a week. And so, but you're in clinic 4 days a week. You're still potentially doing rotations with some of these other doctors. We have a doc here, an ND, who's involved in the public health system. So we get to do rotations with him. So it's nice being able to go offsite and kind of get, some ideas and some experience with some other physicians as well. We have 1 IRB approved research study. So if you don't know very much about me, I have a master's in evaluative clinical sciences from Dartmouth College and was the clinical research director at Cancer Treatment Centers of America for 4 years in Philadelphia. So I managed drug trials and every aspect of it. But we obviously, a lot of what we did were called investigator initiated trials. And so coming up with an idea, working with, a different company on a certain product or looking at protocols and then going through the whole protocol writing, informed consent, going through the IRB process and collecting data as well. So we are very heavily focused on obviously the clinical medicine aspect of it. We're trying to introduce some new research components and, I would like people to be publishing and presenting as well. I think that would definitely be the goal. It's not always everybody's cup of tea to be presenting at national conferences, but it's really important to be able to give back and and contribute. We do case preview and review every day. So whatever cases are there that we're going to be seeing, in the morning, we meet ahead of time. We discuss all those cases. We make sure we have all the appropriate documentation from the medical oncologist if the patient has had a treatment change, or maybe there's progression and a new chemo regimen is coming, or they're getting ready for surgery. Obviously, we're making sure that we're making recommendations that are in accordance with those occurrences. Trying to think of what else you guys need to know. Since Dr. Dunn does have really significant experience in acupuncture, our preference is for a dual degree, because you're going to be able to spend a lot more high quality time with Dr. Dunn if we have somebody who has acupuncture, dual degree. About 80% of her patients right now are acupuncture focused. So it would allow you to see a wider variety of patients if you were dual degree, but we will look at any application. Not sure what else you guys want to know. So that's a start. What questions do you guys have for me?
Emily has a question.
Okay. Demographics, is that the question that
Yes.
Yep. So anyone describe the demographics, focusing on an age group. Okay. So I actually also am the medical director of a nonprofit called Chemo and Crayons, which will be cycling up here very soon. So I have a really significant interest in long-term survivors of pediatric cancer, and we do work with pediatrics as well. Obviously in Portland is where the Children's Hospital is. And so I feel like some of the Portland-based docs also end up seeing some pediatric oncology, but we do more than most. Demographics of Eugene, normally our patients are somewhere between about the age of 40 and 80, depending, 40 and 70. I'd say 2/3 to 3/4 women. Eugene is not known to be the most diverse place. I feel like bigger cities are maybe a little bit more diverse. Yeah, we end up seeing, we are starting to see cancers at younger ages. I feel like most facilities are also experiencing metastatic breast cancer patients at 25, where that wasn't something that we saw very frequently a while back, but now we're starting to see more. We see solid tumor and hematologic malignancies as well. So I hope that's helpful.
Okay. Let's see. It looks like I see Dr. Sharon Gurm on the call. And so she's our next speaker. Welcome, Dr. Sharon.
Thank you.
Dr. Sharon is our affiliate residency director at Port Moody Health Integrated Medicine and Cancer Center. Dr. Sharon, the floor is yours. Do you have any slides to present so that I can make you the co-host?
I don't have any slides, so I'll just talk and then some questions. And first off, I want to say thank you, Gary, for organizing this, and thanks to all the students and prospective residents that have joined this conversation. I hope to see most of you in the clinic at some point, because I think that's the best way to really get a sense of what we do at the clinic, and also for us to get to know the residents or potential residents. And it's so great to see how many residency directors there are now. It takes a lot of hard work and a lot of courage to be trailblazing this in our industry and in this field of naturopathic oncology. So I just want to express my gratitude to all of you as residency directors for making this happen, because the numbers keep growing, and that's really encouraging to see. So the clinic is situated in Port Moody, which is about 25 minutes outside of downtown Vancouver. And it's a beautiful setting, really great landscape for anyone who enjoys the outdoors. Very similar to, Seattle, that sort of Bastyr landscape, that area. So, residents may choose to live in Vancouver, or they may choose to live in closer to Port Moody, closer to the clinic. And that really depends on, sort of what kind of life balance, work-life balance you want. There's a lot of flexibility there. Both Dr. Adrian and myself offer a residency. So my residency is naturopathic oncology focused exclusively. Dr. Adrian, her residency is actually quite unique in that it is a naturopathic oncology combination with complex chronic disease. Both residencies are 2 years. I'm speaking a little bit about Dr. Adrian's because I'm not sure that she's going to make the call. And so I want to make sure that you get sort of a sense of what her residency is about and just a little bit of flavor of that very interesting, unique residency. Our residents will, you'll learn a lot of clinical skills, develop a lot of clinical skills throughout the 2-year residency. We start with, some of the core competencies and really, want to make sure that some of the didactic learning is really part of the focus for the first 6 months of the residency. And it varies depending on the rate that, and comfort level for the resident in terms of absorbing that level of information and demonstrating those core competencies in a clinical setting. So once the resident is comfortable, then we start to have the resident work one-on-one with patients. And they'll start to see their own oncology patients. And also along that time, you're learning a lot of hands-on skills. So what we do at the clinic, it's a big clinic. So we have several staff. We've got currently 3 doctors, including myself. And then we also have several nurses that mostly run the IV suite and a lot of the other procedural things that go on in the clinic. And then we also have an administrative staff of about 3 to 4 individuals that run the front desk and so on and so forth. It's about, it's a large clinic, about 4,000 square feet. So there's a lot of moving parts at any given time. So we're really looking for a resident that is comfortable working with all of those moving parts and being able to multitask and feel confident in what they're able to do for patients, and also feel confident working with other members of the team. And the best way to really for us to gauge that, I've realized, especially throughout the COVID pandemic, it really underscored the importance and the value of the preceptorships. So both Dr. Adrian and I, we love to offer mentorship. And for anyone who would be interested in a residency, it is paramount that you engage with us on some level to do some preceptorship at the clinic. And definitely, like some of the other residency directors have already spoken to this point, it's important to have a dedicated amount of time. One day is not going to be enough. So we ask for at least 4 to 5 shifts for preceptorship. And if you're really interested in doing an externship, which again, I have to underscore how important that is, because that really gives us, if you can do a 1-month externship at the clinic, 3-week externship, that really gives us, the platform and the time frame for us to really be able to understand whether this is a good fit, whether you're going to be a strong applicant for our particular residencies. And vice versa, for the student, it allows the student doctor to be able to gauge whether the clinic is really suitable for them and a good fit for them. All these residencies sound so exceptional. And I think it's really important that students really take the time to figure out which type of residency is most suited to them. So, they're all naturopathic oncology residencies. However, each clinic has their unique features. Some clinics are smaller, and those residents are going to thrive in a smaller setting that maybe offers more one-on-one consultations with patients and not so much, of all of the other sort of clinical skills or treatments rather that, a clinic like mine might offer. And so because there's just a lot more complexity that comes with that. So really, it's important to gauge that, I think, as a resident and get a flavor from all the different clinics, what is offered. So some of the advanced therapies that we offer. So of course, we do all of the standard, clinical consultations with patients, helping them navigate the integrative cancer framework and working one-on-one working directly with radiation oncologists, directly and yet indirectly, because we're not, they are separate. We're in BC, it's a little bit different than it would be in some of For instance, in Portland, we're not so directly communicating with medical oncologists. It takes a little bit more effort, but we've forged a lot of those relationships over the years, and that also has allowed us to be able to establish rotations with medical oncologists, surgeons for our residents, and so on and so forth. So that's also part of the residency program. So in addition to helping them navigate their course of care, oncology care, we offer IV therapies. We also do a lot of photobiomodulation, localized and whole body. We also offer local regional hyperthermia and photodynamic therapy. So those are some of the more advanced therapies that we offer, and a lot of learning goes on there for the resident. And I think I probably just have another, about a minute left. So if there's any questions, happy to take some questions.
Okay, do we have any questions from the group online? Since you're at BC, Sharon, just a quick probably description of how do you get licensed over there, what are the things that are required by the BC board, etc.
Yeah, that's a very good point, Gary. Thank you for bringing that up. So the BC boards, I wish Dr. Adrian was on the call because she could speak to this more eloquently than I can. But I believe the BC boards are offered in August and then one other time in the year. So it's either in January. It's kind of that second one is a bit of a moving target. It's changed over the years. And every year it seems to be offered at a different time. So it's somewhere between January and April. You should, obviously, you need to be fully licensed in order to start the residency. I think that's really the best thing for potential residents to do is actually reach out to the CNPBC, the College of Naturopathic Physicians of BC, and find out when the board exams are offered and what specifically is involved for the American students.
Okay. Speaking about those that are here on stateside, yesterday, Dr. Jasmine Carino, who is the director at the College of Naturopathic, at the Canadian College of Naturopathic Medicine, mentioned at least those who are interested in joining any residencies on the Canadian side, you have to make sure that you have the appropriate visa to be able to work over there. So it's really important to, if you're interested in doing that, also connect with an immigration attorney to get the process going. Okay, let's see. If there are no more questions, then I will give the floor back to Dr. Achjan. Unfortunately, Dr. Parmar had to leave, but Dr. Achjan has a few words for Dr. Parmar.
Hi, yeah, unfortunately, Dr. Parmar had to leave. So I am fortunate to get to speak about my friend and colleague's residency. In Canada, they have 2 locations. They are 100% oncology in the Vancouver or nearby area. They are specifically in Fort Langley and also White Rock. They're a team of over 35 docs and staff, 5 naturopaths in oncology. Their current resident, Dr. Sarah Souls, and she's also 100% involved in oncology. They offer advanced therapies. I know they do quite a lot of IV therapies and a lot of hyperthermia. Dr. Parmar has done a fair bit of research, publishing, and continues to do quite a lot with hyperthermia. He tells us that he's published, or they're about to publish their 10-year data on an ongoing longitudinal study, and the first GBM or glioblastoma paper currently being published, and then 9 others coming. So obviously quite a lot of research there. They're also involved at a local small hospital, so a similar integrative model to the rest of ours. We've had the fortune to work together and trade residents, essentially have our residents go up to his location to experience some of the advanced therapies that they're doing. And similarly, he's had some of his residents come down to our facility, not only to see what we do, but also for our facilitation with rotations in the conventional medical community, because we're, like we mentioned, we're involved with Providence and Swedish Hospital. We've been able to sort of cross-pollinate some of the educational experiences. I wish I could tell you more, but ultimately I think that their residency is an excellent one, located in Canada, a very inclusive and an excellent experience for any residency candidate to consider.
Thank you, Dr. Chad, for speaking on behalf of Dr. Parmar. I think you also mentioned that his resident, Dr. Denoder, is available for to answer any questions in the future. For those who are interested, I can share Dr. Denoder's email at the end of this Zoom call. Thank you again. Let's see. Our final speaker is Dr. Maggie Beeson and Janelle Bell. And I believe, Janelle, you're on the call today.
I'm here, Gary. Let me go grab Dr. Beeson. She was in between patients. So I'm just going to mute you really quick, and then I will go grab her, and then we'll both speak. Okay, let's see. While we're waiting for Dr. Beeson, any additional questions from the group? I think lots of students seem to be interested in, at least for students who are both having on a dual degree course, acupuncture and naturopathic medicine. Seems that naturopathic oncology is will give you that opportunity to be able to.
Dr. Garcia, may I make one addition while we're waiting?
Sure.
A question that we often get, or I guess a concept, is students are often thinking about a primary care residency versus a specialty care residency or an oncology residency. And I thought Dr. Neasley gave a little bit of an approach of an answer to this, and that we do see a lot of patients who have diabetes, thyroid disease, heart disease. A naturopathic oncology experience or residency is going to be really rich with a lot of other pathology. People are going to, residents are going to see quite a lot of primary care type medicine in addition to their naturopathic oncology. So they aren't going to miss out on that primary care aspect if that's a great interest.
Thank you, Dr. Chad. Okay, I see Dr. Maggie's joining our call today.
Hello.
Hi, Dr. Beeson is our residency director at the Yellowstone Naturopathic Clinic. Of course, Janelle Bell is the administrator of Yellowstone Naturopathic Clinic. Maggie, do you have any slides to share with the group? Or are you just going to just speak?
Gosh, yeah, I could have put some slides on. I was doing a talk at the residency day last fall at Bastyr, but I guess I wasn't thinking slides, so.
Okay, that's fine. The reason why I'm asking is because I need to make it the co-host so that you can share your screen. But feel free to just share your thoughts with the group.
Okay, well, I like your background there. Is that the Pentagon?
Yeah, it's the Bastyr Pentagon. University from the water tower.
Okay, let's see. All right, so I, as Dr. Garcia said, I'm Dr. Margaret Beeson, and I'm the owner and medical director of the Yellowstone Naturopathic Clinic. We serve Billings and also the greater Montana community for 30 years. It's how long we've been here, and we're right here in the medical corridor. And we offer both a general and a general oncology residency program. And I think our general oncology program is more unique in our profession in that our residents rotate over at St. Vincent's Cancer Center and see patients that are being treated, with chemotherapy, radiation, et cetera. And then they also spend time in our clinic seeing general practice residents, patients, and not simply oncology. So that people who choose our residency are often really wanting to make sure that their skills as a general practice naturopath are, maintained and hopefully, expanded with their work here, because we are a real family practice as well. So we offer a variety of treatments, IV therapy, joint and cosmetic. We've been doing regenerative injection therapy here for over 25 years, having started with Prolo. And our oncology resident, if they're interested and motivated to do that, they often have that as one of the skills that they use as well. And obviously not necessarily for as an oncology treatment, but for just patients in general. And we also have constitutional hydrotherapy, which we've had for many, many years. We do detoxification programs. We have an acupuncturist and a chiropractor. We have cranial sacral therapy by someone who's been practicing that in our community for over 25 years. And she also does sound vibrational treatments. We carry a full medicinary for our patients' convenience. And anybody's interested can check out our website a little bit more to learn more about what we do. Our demographics are all ages of patients from birth to, I think we have a 100-year-old patient. And as well as many diverse lifestyles. We have a lot of ranchers and farmers here. And then more city people. Billings is growing very fast. I think Montana is the fourth most COVID-driven people moving here from everywhere through COVID. So we have a really fastly growing population here. Sorry to say, and our residency is also unique in the opportunity to rotate with specialist physicians in other healthcare practitioners. So our residents rotate with cardiologists and otolaryngologist and vein clinic and physical therapist, and we're always expanding as much as we can. Once again, during COVID, there were some limitations at both the hospitals where we are in our medical corridor here. They had shut down any rotations for a while, but they're picking back up again, and that's going on.
So I would add in the oncology realm of, I'm Janelle. In the oncology realm, when the residents are at the cancer center here in Billings, they do have access to the nursing staff. They have access to consult with the doctors in between patients, or they also rotate with all of the departments over there to really understand their system and how to best support their system or their patient with the hospital setting and what we have to offer. We just also started a remote location in Miles City. So our residents have the opportunity to go offsite through St. Vincent's Hospital and see patients there. So they're seeing patients for supportive care, and then again would have that direct communication with the oncology doctors.
And since we are more of Montana's a fairly low population, our state is we just went through, we have 1 million now. We got an extra representative in Congress this year for the first time. We have 1 million people. It's the cancer centers here. We have 2, Billings Clinic and St. Vincent's. They serve really the whole eastern part of the state and northern Wyoming. So it's really pretty sophisticated for a lower population. And we actually have one of the few cyber knives in the country to treat brain cancer and prostate cancer. So there's some, interesting aspects in that, even though it's a smaller community, since it's serving such a large number of people, there's a lot of progressive kind of availability and treatments going on. And then also they connect with other larger medical centers like Billings Clinic is involved with their medical center at Salt Lake City and also Denver. And St. Vincent's has, they were just, merged with Intermountain Healthcare, which is quite a large system through Utah, and I think it's Colorado, and maybe they have six states that they're involved with. So There's quite a bit of networking that allows for the specialties of all sort, and particularly more refined specialties in oncology, where we have our OBGYN and head and neck and those sort of specialties. So when selecting a resident, we're looking for someone who's really passionate about naturopathic medicine, about oncology, and about collaborative care. It's important that the resident be open to learning, and be prepared to with their treatment plans and rationales, and be committed to meeting general duties and project deadlines. So we utilize nonviolent and open communication, direct communication. We're always open to suggestions, improvement in a resident's treatment, interest, and goals. And ultimately, our final selection of a resident is based on these factors and on finding the individual that best fits our clinic at a particular time.
Yes, I think I heard other people, just to add on to Dr. Beeson there, I heard some other people talking about selection, and it's important for the residents to come in our selection process, because I think it gives everybody that opportunity to meet face to face. You can learn only so much through video camera, but it really is valuable to have the resident potential residents to come and see where our location is, see if it's somewhere that they would like to be long-term, because our residency is a 2-year residency commitment versus I know some people have 1 year, but ours is a 2-year.
One question that came up was regarding preceptorships. Do you welcome students even before the application process begins? Do you welcome them to do some preceptorships?
Yes, we actually have people come in preceptor at the clinic throughout the year. So we don't have any specific times that are restricted. Sometimes around the holidays, it gets a little more challenging, but we usually try to accommodate what works for the student.
Hey, let's see. Any questions from the group before we adjourn our call today? Okay, well, thank you everybody for joining us today. Thank you, Dr. Beeson, Dr. Chad, Dr. Sharon, and Dr. Joseph, Dr. Parmar, of course, he had to leave early. And Dr. Standish, thank you very much again. And this recording will be made available on the AMC website, as well as I'll also share this with the OncANP. So thank you much, everybody. You guys have a good rest of the day.
Thank you. Thanks, Dr. Garcia. Thanks, everyone.
Thank you, Dr. Garcia.